Hello, everyone. I'm Mia Cotto, FSR's Senior Patient Outreach Coordinator and the moderator for this session. Before we start, I'm going to go over a few housekeeping items. This session is being recorded. After our speakers finish their presentations, you'll have an opportunity to ask questions. When asking questions, please use the chat or the Q&A feature. We will do our best to get to as many questions as possible. We appreciate your feedback and use it to shape our programming. After this webinar ends, please fill out our short survey. You will be automatically prompted to complete the survey after the webinar closes. Finally, we'd like to thank our sponsor, Mallinckrodt Pharmaceuticals, for making this event possible. I'm now honored to introduce FSR CEO, Mary McGowan. Mary became the Foundation for Sarcoidosis Research's first CEO in 2020, leading the organization's mission and patient engagement, partnerships, fundraising, advocacy, and research. With 35 years of nonprofit leadership experience, she previously helmed the Myositis Association, Women Heart, and the Allergy and Asthma Network. Mary holds a master's degree in human resources development from George Washington University and a BA from Trinity University. Over to you, Mary.
Thank you, Mia, and good afternoon, everybody. Thank you so much for joining us for FSR's first webinar of 2025. This is a great way to kick off the new year with our theme of exercise. Thank you to the over 370 of you from 16 countries who are joining us today. So 2024 was an extraordinary year for sarcoidosis and for the sarcoidosis community. Thank you to all of you who joined us for our externally led patient-focused drug development meeting with the FDA in late October. The stories and the information you shared through the surveys and live polls helped to provide the FDA with a clear understanding of why we need more and better therapies for those impacted by sarcoidosis. With your help, FSR was able to provide $800,000 in funding to advance academic sarcoidosis research in 2024. This represents a whopping 255% increase from the previous year's funding. Through this financial support, FSR provided funding to 2 early career researchers through our prestigious fellowship grant and 5 mid-career researchers through our pilot and cardiac grant funding. These funded projects focus on cardiac sarcoidosis, neurosarcoidosis, immune cell responses, identifying new biomarkers, and seeking work on the development of a mouse model, which is essential in drug development. In addition, through the FSR-led Coalition for Clinical Trial Equity, FSR was able to ensure that the Family Medical Leave Act provides job security to any patient or their caregiver when they enroll in clinical trials. This is a huge advancement. And thanks to your commitment, FSR was able to help enroll 3 clinical trials, supporting efforts to identify potential therapies for all impacted by sarcoidosis. And so much more happened in 2024. But 2025 is very exciting as we enter into the new year. FSR is celebrating its 25th anniversary with you. We are already gearing up for Sarcoidosis Awareness Month in April. We have lots of exciting things planned, and we will be sharing more with you soon. But in the meantime, please mark your calendars for the weekend of June 28th and 29th for our 2-day virtual summit. This educational summit will bring patients and caregivers together with world-renowned leading experts for networking and learning. So more to come soon, but again, please mark your calendars for June 28th and 29th. As we move into the new year, tonight seems the perfect time to discuss exercise and physical therapy for sarcoidosis patients. In this evening's webinar, our speakers will cover how sarcoidosis impacts exercise, what you need to know about exercising safely, the purpose of pulmonary rehab, and key research findings. Please join me in welcoming tonight's speakers. Marion Paetznick. Marion is a doctor of physical therapy and advocate for empowering individuals with pulmonary disease to regain strength, mobility, and confidence through safe and accessible movement practices. She blends her clinical expertise with her background rooted in education and group exercise to deliver clear, compassionate, and inspiring guidance tailored to diverse abilities. Marion's commitment to the sarcoidosis community is personal, as her family has been affected by this disease. A proud graduate of the University of Washington, Marion is dedicated to improving her approach to care by integrating innovative tools and technologies. She stays informed about advancements in technological tools such as pulse oximeters and smartwatches to ensure her patients benefit from the latest and most accurate metrics to support their wellness journey. Also this evening, I'd like to introduce Dr. Claire Child. Claire is a physical therapist and a teaching faculty member in the Department of Rehabilitation Medicine at the University of Washington. She is an American Board of Physical Therapy Specialties certified specialist in cardiovascular and pulmonary physical therapy with clinical research interests in advanced heart and lung diseases, health systems innovations, and the use of technology and behavioral science to augment physical activity in at-risk populations. Dr. Child is also a PhD candidate in the Mary Beth Brown Lab, currently investigating novel approaches to home-based exercise training in idiopathic pulmonary fibrosis and lymphangioliomyomatosis. So Marion, thank you so much again for joining us today, and I'll pass it over to you. Thank you.
Thank you so much, Mary. And I just want to welcome everyone and thank you again for joining us for this first webinar. My name is Dr. Marion Paetznick. I am a physical therapist with a special interest in sarcoidosis, as she just mentioned. And this webinar is about giving you the tools and education you need to confidently embrace exercise as part of your regular routine. Today, we're going to learn about the latest research. We're going to learn actionable tips and strategies to help you feel your best while you're living with sarcoidosis. Slide, please. All right, this part's important. Before we dive in, I have to share this disclaimer. This information on the webinar is for educational purposes only and is not intended to replace any medical advice that you receive from your healthcare provider. Always consult your healthcare provider before starting an exercise program. The recommendations here are general and they might not be suitable for everyone. It's important that you consult your doctor to determine what is best for your unique medical history and current medical status. The hosts, presenters, and organizers of this webinar cannot assume liability for any risks or injuries that might result from the use or misuse of this information. Your safety is a top priority. So before starting any new exercise program, always consult with your provider. Thank you so much. Next slide, please. And I'd love to tell you a little bit more about myself. My journey into the world of physical therapy was inspired by my dad's struggles with sarcoidosis. I really feel passionately that people living with sarcoidosis deserve better. While we don't have all the answers about sarcoidosis, we absolutely do know how to make people stronger, and we have the technological tools to build a community. Together, we can take meaningful steps to improve the quality of our lives and the quality of our outcomes. This webinar series was developed in partnership with the Foundation for Sarcoidosis Research to help you embrace a more active lifestyle. My hope is that you will leave each of these sessions feeling embraced, feeling empowered and energized. Next slide, please. Here is our roadmap for today. So here is what we're going to be discussing. Number one, we'll be talking about the science behind why exercise feels so challenging. Next, we'll explore how exercise can serve as a powerful tool to help you manage sarcoidosis. Then we'll dive into cardiopulmonary rehab. It's a program that's clinically proven to support people with conditions like sarcoidosis safely build their strength and stamina. You'll learn all about what to expect and why it's such a game changer for people living with sarcoidosis. Safety is going to be a major focus of today's session. So we've created a comprehensive checklist to help you discuss possible risks or complications with your doctor. Together, we're going to walk through each of these items so that you feel informed and confident moving forward with exercise. We'll also cover tools and tips for monitoring oxygen so that you can exercise with confidence. Finally, we're going to look ahead and see what's coming in future sessions, including exciting insights about how technology and research are shaping the future of sarcoidosis care. There's a lot of information that we're going to cover, and I'm going to talk quickly. But I want you to know that the slides are available and this is being recorded, so you'll have it all available to you later. And by the end of today, I'm hoping that you're going to feel equipped with tools and strategies and have a sense of confidence and safety for you to start exercising. All right, next slide, please. So let's get into it. Let's start by understanding why exercise can feel so challenging. Let's get into the science of why it feels so bad. Sarcoidosis patients have overactive immune systems, and that leads to chronic inflammation. And I like to think of it as more of a positive spin, like you're actually immune system overachievers. Like think about it that way. Another way you can think about your immune system is as your body's military. It's always on duty. It's ready to defend against any threats like infection. And in sarcoidosis, that military is overactive. They're launching operations, they're bombing targets, even when there's no enemy at all. And just like an overactive military would drain your resources and disrupt your daily life, an overactive immune system is draining your resources, leaving you feeling fatigued. So let's talk about granulomas. One of your immune system's unhelpful military operations is forming clusters of cells called granulomas. These granulomas can disrupt your body. They can block airflow in your lungs, and they can interfere with electrical signals in your heart. They can also weaken your muscles. Your body ends up fighting an unnecessary war, which adds more to your exhaustion. Next slide, please. So now that we've talked about inflammation and granulomas, let's talk about how that impacts your lungs when you're trying to exercise. Here are some of the symptoms that you may have experienced, because 90% of people do. Fatigue. This is such a big one for sarcoidosis patients. Not only is chronic inflammation depleting your resources, but oxygen is not getting to your muscles. And that makes exercise feel so much harder than it should. Persistent dry coughs. Have you ever had a coughing fit that just wouldn't stop? Not only can these fits interrupt your breathing patterns and focus, they can make exercise really uncomfortable. Just a quick side note, my dad used to collect the eggs from our chickens, and the dust from their feathers would really trigger these coughing fits. Sometimes really simple tasks can trigger coughing fits, and it can be a real challenge. Shortness of breath is another issue. The medical term is dyspnea. This happens when inflammation or granulomas in your lungs narrow the airways, and they make it harder for the air to move in and out. Exercise can feel exhausting. It can feel scary or frustrating when you can't catch your breath. Chest pain is another issue. Granulomas and inflammation in your lungs can irritate the nerves all around your rib cage, including up into your armpit. That can cause pain when you're taking deep breaths. And it can even cause fear of just the huffing and puffing that can come and that makes you want to not exercise. Then we have wheezing. Wheezing and swelling and inflammation, once again in the airways, is common during flares, and it makes it harder to breathe. These symptoms are real barriers to exercise, but by understanding them and your triggers, you can manage them properly and you can start to feel more confident about staying active. Next slide, please. So here we are, we're going to shift our focus to how sarcoidosis can affect your heart. We're going to break it down into 3 categories. We've got electrical problems, we've got pumping problems, and we have mixed issues. First, electrical problems. You can see at the top here, sometimes these granulomas or fibrosis can occur in the center of the heart, as you can see with that little yellow highlight. And that disrupts the heart's electrical system, leading to a condition called heart block. Sometimes it's very mild, just a slight delay between the pumping from the upper chambers to the lower chambers. But other times it can start, the heartbeat chambers can be completely out of sync. And that can be a major risk. That's why these risks make it essential to talk to your doctor before you start exercising. Another problem with sarcoidosis, you can have pumping issues. Sometimes granulomas or fibrosis can be located on the sides of the heart, where the pumping muscle action happens. And when these muscles can't pump properly, it leads to a condition called heart failure. The good news is there are many patients with mild to moderate heart failure that can still exercise safely with proper supervision. And then we can have mixed issues with sarcoidosis. Some patients experience a combination of electrical and pumping problems. These mixed issues can make it especially important to get a thorough evaluation to determine if exercise is safe for you. Each person's situation is unique, so have a talk with your doctor. Understanding how sarcoidosis affects your heart will help you make better choices about exercise. Next slide, please. So let's dive into how cardiac symptoms can make you exercise feel more challenging. So you might have an irregular heartbeat. We touched on this before. Because granulomas and fibrosis can affect the electrical symptoms, signals in the heart, that might mean dizziness. You may feel faint during an activity. You may have a rapid heart rate. And in rare cases, it can even lead to cardiac arrest, which is your heart completely stopping. So I just want to mention again, how important it is to speak to your doctor before starting an exercise program. You might also notice shortness of breath. When your heart can't effectively pump blood and push that blood, fluid can start to back up into the lungs. And that can make it really hard for you to catch your breath. It might make it hard for you to breathe laying down. This can leave you feeling really winded, even with really light activity. And it's frustrating and it's exhausting. But knowing your limits and pacing yourself can really help. Next, we have inflammation in the heart and surrounding tissues, which can cause discomfort during activity. This pain can make it hard to feel confident about exercising. Working with your healthcare provider can make such a huge difference. Fatigue. Now, this is a double whammy, again, with shortness of breath. When your heart struggles to pump, your muscles just don't get the oxygen that they need, and you feel drained even after short bursts of activity. Finally, you might notice swelling in your legs or your feet, and that's called edema. When your heart doesn't pump well, not only can fluid back up into your lungs, but it can also back up into your legs. Swelling can make exercise very uncomfortable. And if you notice a dramatic increase in weight, you should contact your doctor right away, anything over 3 pounds. This could be a sign of worsening symptoms. And I know this sounds overwhelming, but with the right strategies and support, you can definitely exercise safely. It's about learning how to listen to your body and working with your provider to create a plan that works for you. Next slide, please. So let's talk about why oxygen is such a critical puzzle for sarcoidosis. Our bodies need it. And when our oxygen levels are low, it impacts every system. As we talked about in previous slides, sarcoidosis causes shortness of breath and reduced oxygen delivery to your tissues. When your body isn't getting enough oxygen, you may feel fatigued, you might feel breathless, you might feel dizzy, your heartbeat is going to be racing, and you're going to get tired faster. We also know prolonged low oxygen can worsen your inflammation, and that worsens your scarring. That makes your symptoms worse and makes your overall prognosis worse. And that's why it's very important to monitor your oxygen during activity. Here's some steps to help you manage those oxygen levels. Use a pulse oximeter, and we're going to talk more about that later. Basically, it's a little simple tool that you clip onto the end of your finger. It'll help ensure you're staying in a safe oxygen range. And then you should follow your oxygen saturation targets set by your doctor. And if you're not sure, ask your doctor, hey, do I have any oxygen targets during exercise? We'll go over that more later. If you use prescribed oxygen, make sure you know when and how to use it. And I also want you to focus on breathing through your nose. Oftentimes when we get tired, we tend to breathe through our mouths when the oxygen is actually going into our nostrils. Another important thing to think about, and we're going to talk about this one again as well, is cardiopulmonary rehab. It is a specialized exercise program tailored to improve your quality of life by safely building strength and endurance. Let's recap the warning signs of oxygen because this is important to know. You should watch out for shortness of breath, persistent coughing, the coughing fits, a rapid heartbeat. You may also experience lightheadedness, confusion, or restlessness. And you can look for visible signs as well, like pale or blue-gray tint, or you may have some paleness in your eyelids as well. And I included a picture at the bottom that shows a red hue on the outer edge of the eyelid, and that indicates good oxygenation, while a paler hue on the outer edge of the eyelid indicates lower oxygen. So you can watch for these visible signs as well. Next slide, please. Living with sarcoidosis can make physical activity feel totally overwhelming, especially when your symptoms flare up, but avoiding activity can make your symptoms even worse. So let's look into this cycle, and we're going to break it down, and then we're going to talk about how we're going to be breaking that cycle. First, your symptoms flare. You get fatigue, you get pain, you're breathless, and that makes exercise feel impossible. So you reduce your activity, and that's a natural result. And as a result of that reduced activity over time, that leads to deconditioning. Your muscles are weak, your joints are stiff, you're out of breath all the time now, even with short bursts of energy. And that leads to worsening symptoms. Now, daily activities are really taking it out on you. It's really hard to manage your fatigue. And that can lead to more frustration and fatigue and anxiety about what happens when the next flare comes, what happens when these symptoms increase. All of these make entering into an exercise program even more daunting. So let's talk about how we're going to break this cycle. First, as I've mentioned several times, look for support. You got to start with that medical clearance. We're going to get into it. Then, after you talk with your doctor, you should look into some tailored programs. See if Cardiopulmonary is around you and enroll. Next, if that's not available, you can try starting small. Take little exercise snacks. Try taking little 5-minute walks a few times throughout the day instead of taking one big walk after dinner. Focus on being consistent more than intensity. Try tracking your progress. Use a journal or an app and log your activities. You can track things like oxygen levels, heart rates, rate your symptoms, and your fatigue. There's lots of great technology options out there. So go ahead and dig into it. And setting goals that are clear and achievable help you prevent frustration and keep you motivated. Something like adding 5 minutes every day is a great place to start. Next slide, please. So enough about negativity and sarcoidosis. Let's get into some good news. Let's share some good news here. How exercise can help you regain your energy and improve your quality of life. Now, one of the most powerful benefits of regular exercise is how it strengthens your heart. And that's a key player in fighting fatigue. Your heart is made of muscle, and just like your arms and your legs respond to strength training, your heart responds to regular aerobic exercise. A strong heart can pump more blood with every beat, and that is called stroke volume. For people with sarcoidosis, this is critical because a well-trained heart means less fatigue. Let me explain that. If you have a strong heart, it might only take you 10 beats to help you climb a flight of stairs. But if your heart is weak, it might take you 15 or even 25 beats to get up that same flight of stairs, and that's going to leave you tired and out of breath. Fewer beats means your everyday activities feel easier, and that translates to more energy, less fatigue, and a better ability to handle things like walking or playing with your dog. A stronger heart increases your exercise capacity, and that means over time, you'll be able to do more and more. So similar to that example about stairs, not only will you be able to go up one flight of stairs without your heart beating, over time, you can expect to go up maybe 3 flights of stairs without getting out of breath. So on the right here, you're going to see a comparison of an untrained heart versus a trained heart. An untrained heart is pumping less blood with each beat. You can see it takes 20 beats to get to 1 liter, while the trained heart only takes 16 beats to get to 1 liter. So more beats equals more fatigue, but less beats equals less fatigue. And that means more energy for you. Next slide. Exercise not only grows your muscles, it also helps you grow your capillaries. And capillaries are those tiny little blood vessels that fuel your brain, your muscles, and your heart. So let's talk about how that's going to improve your health. Here we go. I have it underneath that in that subtitle. More capillaries equals lower blood pressure. Lower blood pressure equals less inflammation, and less inflammation equals less symptoms. Let me try and explain it. I hope this makes sense. I have my little visual here. Imagine you have a garden hose and here's the water. It's going through right here. You can imagine the water pressure is going to be pretty high, right? But then here's our capillary growth. We've got all these little holes. Now the water has more outlets to go out of. And you can imagine that the water pressure now is going to be much lower. Your body is going to work in the same way. That overall pressure is going to drop, and that is going to put less stress on your heart, which is going to lower systemic inflammation. More capillaries reduces fatigue by providing better oxygen delivery to your muscles as well. Everyday tasks like climbing the stairs feel easier because your muscles are getting the oxygen that they need. And this is going to increase your endurance and reduce your fatigue over time as well. And then the benefits of more capillaries don't stop just at your muscles. This also helps with your brain. I know brain fog is a big thing in sarcoidosis. Having more capillaries means better blood flow to your brain too. All that beautiful density is going to be growing into your brain matter as well. And that's going to help you with memory, focus, reducing your brain fog. It is a win-win for your body and your mind. Next slide, please. So let's look at how exercise can make breathing easier. While exercise might not increase your lung capacity or gas exchange directly, it does train your entire cardiovascular system to deliver oxygen more efficiently and effectively. And that improvement is measured by VO2 max. You can think of VO2 max like the fuel efficiency in your car. A higher VO2 max means your body can get more miles per gallon, allowing you to take on more activity with less effort. Exercise strengthens the diaphragm and the other muscles involved in breathing as well. And that improved airflow helps you reduce your fatigue as well. Next slide, please. But I just want to drive this home. Exercise is more than just these individual benefits. It is about being your very best self. It's about showing up to your life ready to take on whatever challenges come your way. And here are some other ways that exercise can make a huge difference for you. Exercise helps you fall asleep faster, stay asleep longer, and wake up more refreshed. That reduces fatigue and gives you more energy throughout the day. Quality sleep can also help reduce systemic inflammation, and it's been shown to help with sleep apnea, which is common among sarcoidosis patients. Exercise boosts your mood and reduces stress and depression. You get those feel-good chemicals like endorphins and serotonin and dopamine, and that promotes an anti-inflammatory state. Exercise can help you regulate your immune system. It can calm your overactive inflammation. I want you to think of it kind of like when you have 50 tabs on your laptop open and your computer freezes. Exercise is like hitting the reset button. We are helping our body get back into balance, and everything is going to be working smoothly again. Next slide, please. All right, this is the really good stuff. Cardiopulmonary rehab, woo! Okay, cardiopulmonary rehab is by far the best way for sarcoidosis patients to safely and effectively start exercising. It's a customized program that combines exercise, education, and support designed to help you breathe better, get stronger, and move more. These programs are supervised by healthcare professionals, and they ensure everything is safe and tailored to meet your specific goals. Research consistently backs up its benefits. Study after study show that it improves endurance, it reduces shortness of breath, it improves your mood, it has long-term benefits too, like fewer hospital visits. Next slide, please. So what does cardiopulmonary look like? What are you going to expect if you enroll in one of these programs? Well, first, you're going to start out with evaluation and baseline tests. You might do a few exercise tests like a 6-minute walk test, where you walk for 6 minutes and we compare it against age-matched peers. And that information helps us collaborate and set clear, achievable goals and get us on our path. Next are your weekly sessions. These include supervised workouts. We polish your edges by walking on a treadmill at increasing progressions or using a recumbent bike, and strength training will also be included. A healthcare professional is going to closely monitor your oxygen and your heart rate with medical-grade equipment, making sure that you're safe. You'll also get specialized education, and I can't emphasize how important I think this is for people, this bit of support. You'll learn about things like reducing fatigue or recognizing low oxygen. You might also learn about breathing exercises or techniques to strengthen your diaphragm without fatiguing the rest of your body. What makes cardiopulmonary so valuable is the support you receive during these first few weeks. And it's what we see. It's really hard to start an exercise routine, period. And then you add sarcoidosis on top of it, and it is like overwhelming. And when you are trying to establish that routine, it's really challenging. Your body is trying to grow and work and adapt by growing capillaries and increasing that stroke volume, but that takes time. And having someone to guide you through with empathy and encouragement can make such a huge difference. Patients often report that once they've built that foundation, that they're able to better manage on their own. Finally, the program will wrap up with some testing to measure your progress. Sarcoidosis patients can walk 40 to 60 meters farther during that 6-minute walk test I mentioned earlier, and that's 4 to 6 school bus lengths further in 6 minutes. Patients also reported significant improvements in their breathlessness and their fatigue. If everyone on this webinar signed up for cardiopulmonary rehab after this, I would just be so happy. I'd be over the moon tomorrow. It is proven to improve the lives of people living with sarcoidosis. So while sarcoidosis rehab, next slide, sorry. While sarcoidosis rehab is hands down the best choice for sarcoidosis patients, while cardiopulmonary rehab is hands down the best choice for sarcoidosis patients, accessibility is a real challenge. Most of the time, these specialized programs are only available in big cities. So if you're in a rural area, what are you going to do? Well, we're here for you. That's where this medical clearance comes in. Sarcoidosis affects everyone differently. An individual approach is absolutely critical. All the experts agree that you need to get in there and see someone before you start exercising. I just want to draw attention one more time to everybody's at the bottom. See that? Always consult your healthcare provider before starting an exercise program. It is so important to get those baseline assessments and also to get that in-person, how are your oxygen levels? You know, they'll work on that with you. We'll assess the risks. So next slide, please. In order to help you have that well-informed conversation with your provider, we've created a checklist for you, and we'll share that with you later. It's designed to help you have a thorough conversation with your healthcare provider to identify potential risks and address any areas that might need extra attention. I want to just remind everyone, even if you check all these boxes today in the webinar, that does not mean you have a green light for exercise. You must check in with your doctor. Conversely, if you aren't able to check every box, does that mean exercise is off the table? No, absolutely not. It means that you should just have a more informed conversation about your risks. So let's get into the first item. I do not have pulmonary hypertension. So pulmonary hypertension means that the blood vessels in your lungs have narrowed, and that makes the heart work a lot harder when it has to pump blood to get to your lungs. That makes exercise really challenging, and pulmonary hypertension can have serious consequences. If it's ignored, a life-threatening heart arrhythmia can arise, and that's incredibly serious. Next slide, please. So our next item on the checklist is my oxygen stays in safe ranges during mild or moderate activity. So your oxygen, we've just talked about it. It's so important in sarcoidosis to know where it is during exercise. And that's why we want to stay on top of it. Our next item is my lung function or spirometry is stable with no recent declines. Stable lung function means you're getting ready to take on physical activity and give your body the oxygen it needs. So if your lung function has been declining, it might not be the best time to introduce new exercise. Number 4, I do not have any new or worsening shortness of breath, persistent cough, or chest pains, because symptoms like these might indicate active inflammation or other changes that need attention. It's important to address them first to ensure that your exercise is safe. Next slide, please. I do not have a history of heart problems or heart failure. Your heart has to work really hard during exercise, so understanding its condition helps you prevent unnecessary stress and make better choices. Whether it's a minor rhythm issue or a bigger concern, knowing where you are is for the best. I also want to draw your attention to the left-hand corner where we talk about ventricular tachycardia. That's a very serious cardiac arrhythmia that can happen in sarcoidosis patients. And once again, it's just crucial to speak to your doctor to rule any of this out and know where you're at. Number 6, I have not experienced dizziness, fainting, or chest pain during or after activity. Checking for symptoms like dizziness or chest pain help ensure that your exercise routine is safe. If you notice an increase in these symptoms with activity, it's important that you talk to your doctor right away. This could be a sign of a more serious complication. Number 7, I do not have neurological symptoms such as seizures, significant muscle weakness, or balance issues. Because safety is key, and knowing if you have any concerns like this ensures that you are not at risk of falling. Number 8, I feel confident in my ability to remember and follow safety guidelines during exercise. So you might have memory or attention issues like ADHD, and exercise is absolutely still possible, but you may need some extra tools like timers to help remind you to take your vitals and keep you within safety guidelines. Discuss things with your doctor and help create a plan that works best for you. Next slide, please. Okay, we're almost there. I am not experiencing severe fatigue or flare-ups in my sarcoidosis symptoms, because if you're experiencing severe fatigue or flare-ups, it could indicate active inflammation, and exercise during this time might prolong recovery or even make your symptoms worse. Number 10, I am not currently on high-dose steroids that might weaken my muscles or bones. So steroids are often prescribed for sarcoidosis patients, things like prednisone, and they can weaken your joints, your muscles, and your bones. And that can increase your risk of injury, especially during those high-impact activities. If you're on steroids like prednisone, work closely with your doctor to create a low-impact exercise plan. With the right precautions, you can definitely still stay active and build your strength safely. Next one is I do not have other medical conditions that could make exercise unsafe without supervision. So there are other things you might have going on. You might have diabetes, you might have some other severe joint pain unrelated, and that might require extra supervision. So be mindful of those things as well. Next slide, please. Because oxygen is such a critical piece for sarcoidosis, it's essential to talk to your doctor about what your oxygen targets are. If your doctor has prescribed oxygen to you, it's important that you understand how and when to use it during exercise. Make sure you have the appropriate mask, make sure you have everything, the tubing, whatever you need. Ask about a pulse oximeter. Your doctor may recommend using a pulse oximeter to monitor either your oxygen or your heart rate while you exercise. These devices provide valuable real-time feedback, and that'll help you make better choices. And then your provider might also do these baseline tests that we've talked about, the 6-minute walk test, the 2-minute walk test. And there's also a 30-second sit to stand test. And those are great tools for you to start setting goals and seeing your progress. Next slide, please. So let's talk about measuring your oxygen. This is exciting. This has changed recently. How do we measure our oxygen? And what you'll need to do that is a pulse oximeter. That's a device, you clip it just right on the end of your, I actually don't have one with me at the moment, but you clip it right on the end of your finger, and it uses light to estimate how much oxygen is in your blood. Oxygen-rich blood is going to absorb more light, and then oxygen-poor blood is going to absorb less. And then the pulse oximeter does a little calculation, and it spits out an estimation of your oxygen saturation based on that difference. And the reason I explain that to you is because if you understand how it works, then you can understand why the pulse oximeter has limitations. And its limitations are that it doesn't always provide accurate readings for people with darker skin. And that's because the pigment in your skin is interfering with that light signal. Sometimes those over-the-counter general wellness pulse oximeters can be off by as much as 2%. So it's important that you know that. If you look down there, it says not all pulse oximeters are created equal. If you have darker skin, or you are at risk for low oxygen levels, make sure you invest in an FDA-cleared device. These are brand new guidelines that they've come out with. They provide rigorous testing, and they ensure accuracy for all populations, diverse populations. Many of these devices are available through prescription from your doctor, but there are a few that are available over the counter. And I have one in the corner here, the Nonin True O2, that has met the FDA standard as a cleared medical device. And the FDA is working hard to continue to improve guidelines and clear devices and just make pulse oximeters accessible for more people. Next slide, please. I also want to go over some practical tips and important factors to consider for accurate readings. Make sure that you are doing it regularly. So try to find a time of the day where your hands are warm and you are calm and not shaky after you've had your coffee, to make oxygen checks part of your daily wellness routine. Keep a record. You can download lots of apps. There's so many cool apps out there. And you can keep track of your oxygen. You can keep track of your heart rate, all kinds of things. Or you can do it old-fashioned. You can do a journal. That's great too. And then you want to keep a record. Look at trends. Don't focus on just one reading. Look at all the oxygen readings over time. If your oxygen is consistently dropping or your heart rate is rising, you need to contact your provider. This is just another quick side note about my dad who lived with sarcoidosis. He knew his heart rate was really high, but he was really busy with a project at work. And he was like, oh, I think it's just like a flare up. I'm going to finish this project. This is really important at work. And he ended up postponing his care. And when he got to the doctor, it turned out it wasn't just a regular flare. It was a very serious MRSA infection. And he had put himself in a really terrible position by postponing his care like that. I just want to emphasize again how important it is to be proactive when you have sarcoidosis. Do not ignore your symptoms. Next slide, please. Oh, I'm sorry. Stay in that slide. Can we go back? Here are some other pointers I forgot to give you. You want to use your index finger or your pointer finger because this actually has the best blood flow, and therefore it provides the most accurate reading. You want to wait for a steady number. So oftentimes after you exercise, your oxygen will dip and then it'll come back up. So you want to wait and see where the oxygen goes until that number is consistent. Keep in mind cold fingers are also something that can disrupt the blood flow and give you inaccurate readings. You want to make sure your hands are still when the device is measuring. And just another reminder that the pigment of your skin can affect device signals. So if you're at risk for low oxygen, invest in that FDA cleared device. Before we move on to the next slide, I have a confession to make to everybody that's on this. call tonight. I have not always been a physical therapist. This is actually a brand new career for me, and the letters behind my name are only a few months old. I just graduated last June, but by some incredible stroke of luck, I got into the University of Washington and I met someone who has just been a huge inspiration to me, and that is Dr. Claire Child. Dr. Child is leading the way with her innovative research, combining cardiopulmonary rehab with wearable technology to create a hybrid approach where in-person clinic visits are reduced, and that saves you a lot of time and energy while you're still being delivered this specialized, personally tailored exercise. I've been really inspired by her work, and I think you'll find it just as exciting as I do. So it is my absolute pleasure to introduce Dr. Claire Child. Next slide.
Wow, thank you for that introduction. And I'm so honored and privileged to join you, Marion. This presentation has been wonderful so far. I want to just add a personal story related to sarcoidosis. Before I decided to pursue research here at the University of Washington, I worked as a lead physical therapist at the University of Pennsylvania, and I worked with some patients that had both pulmonary and cardiac sarcoidosis. I was in Philadelphia at the University of Pennsylvania during the beginning of the COVID-19 pandemic, and I remember we had a patient that received a lung transplantation for sarcoidosis, for pulmonary sarcoidosis, and because of the COVID-19 pandemic, which was going on, there was no outpatient pulmonary rehabilitation for this patient after they left the hospital. So I haven't worked a lot in outpatient pulmonary rehabilitation. My clinical practice has been in acute care hospitals, working a lot with patients with these advanced heart and lung conditions. But for this patient, I felt really strongly that I needed to at least give them some of the tools for them to use at home, because I just had this huge procedure. So I stayed up late to put together a little booklet, kind of similar to the work that I've been doing in my PhD. But for this patient, I essentially created some of the essential components of pulmonary rehabilitation, like Marion has done here, and it was really impactful for this patient. So this has continued on into some of the work that I'm doing now, where I've shifted a little bit more into the home and community dwelling space. And we know that in the literature, we know the benefits of cardiac and pulmonary rehabilitation are really evidence-based for lots of patients that have that are living with chronic stable diseases like sarcoidosis that can affect the heart, the lungs, and also other organs. And unfortunately, though, for pulmonary rehabilitation, only about 5% of patients partake in pulmonary rehabilitation worldwide. Here in the United States, cardiac rehabilitation participation is a little bit higher because of many efforts to increase that participation. So depending on the study, it's about 15 to 20% of people that qualify or are eligible for cardiac rehabilitation end up completing it. What pulmonary and cardiac rehabilitation are structured exercise programs, historically, traditionally in a center with exercise specialists and physicians, providers available to help monitor and make sure that exercise is tolerated well. And some of you may have participated in these programs. Since the COVID-19 pandemic really made it difficult for individuals to participate in cardiac and pulmonary rehabilitation, there was a rapid uptake in participation in new types of models of these programs. And so you may know this, some of you may have, again, participated in some of these new models, but I think definitely more in the cardiac rehabilitation space, there are more technology-enabled, telehealth, telemedicine-enabled types of programs that are emerging. It's not yet the standard of care. There haven't been a lot of research studies in sarcoidosis, but there are some really positive, promising studies out there that actually show that a home-based, or maybe what's called a hybrid-based approach, can actually increase participation. People don't have the historical barriers of needing to drive to a pulmonary rehabilitation center. They can still receive some of the same education, some of the same supervision in their homes. They can perhaps, a hybrid type of approach means that the first session, or maybe the first two or three sessions, are done with supervision. So somebody is monitoring how you're exercising, and completes an exercise test, starts you on an exercise program, teaches you all the components of the program, and then you're able to continue that program in your home space, or perhaps in a gym that's close to you, or a physical therapy clinic that's close to you. And again, then increasing the access and increasing the adherence. So, so really exciting time to be working in this space. Our lab here at the University of Washington has tested a couple of even more innovative approaches in a couple of at-risk patient populations, a little different than sarcoidosis, but a lot of similarities in the risk for exercise induced or exertional desaturation of oxygen. These populations are called, you may not have heard of them before, but idiopathic pulmonary fibrosis and a rare interstitial lung disease called lymphangioliomyomatosis, or LAM, that primarily affects females of childbearing ages. And we were able to take a similar hybrid approach that involved these patients coming in and doing some exercise tests with us, and then completing a 100% home-based program enabled by wearing a smartwatch and then also a pulse oximeter. These patients were screened to have low or moderate cardiovascular disease risk or less by a physician before starting the program. So we did not have any cardiac telemetry monitoring, but that is something that is being added in some of the cardiac rehab models, these new models. And our study results have been really promising. Patients really like to exercise where they are. They like to not just have their structured exercise sessions at cardiac and pulmonary rehab counted, but they like all of their physical activity to be counted. They appreciate higher quality technology in their homes, like Marion mentioned, and she helped conduct some interviews with some of our participants. The device quality can really make a difference in people's sense of safety, of their sense of autonomy. And so I think this is a huge piece, not just for people that maybe are having a flare up and would benefit from a visit to a structured supervised rehab, but just for as part of everyday life, as physical activity as a part of people's everyday life. So again, exciting time to be in this space, and we've had some success in these other diseases. We are really interested potentially studying sarcoidosis as well, understanding that each pathology is a little bit different, and that's really why your doctor knows you best. So if you're interested in starting an aerobic exercise program, making sure that your doctor, they can do many of the same things that we've been studying. They can make sure you do an exercise test to clear you. They can look at your specific risks potentially during exercise, and perhaps in collaboration with an exercise professional or a physical therapist, get you started on a program. So really happy to be here, and thanks again, Marion. Marion is just a fantastic, she was one of our just most amazing lab students, and really has become a friend over the last few years as well.
Thank you so much, Claire. So let's go to the next slide. And I love that. That is so exciting. I just really appreciate that you came out, Claire. That's so awesome. Let's talk about what's coming down next for us in this series, because we have so many exciting things planned to keep you moving forward. In our next session, we're going to start diving into cardiovascular training for every level. And I saw somebody say in the chat, actually, while Claire, while you were talking, my husband, he can't stand. That's okay. We are going to have seated options We are going to have exercise for everyone is the goal. And we're going to talk about hitting that sweet spot. So you're gaining the benefits of exercise without overdoing it. So here's what you're going to need. You're going to want a pulse oximeter to monitor your heart rate and your oxygen levels. You're going to want your prescribed oxygen close by and the mask if you need it. You're going to need a sturdy chair with no armrests so you can move your legs and arms freely. You're also going to want a towel and a glass of water. That's just always a good idea when you're working out. And then in future sessions, we're going to explore strength training as well as improving flexibility and balance. Once again, it's about every level. We are going to have tons of ways to exercise totally seated in your chair. And we're also going to have fun challenges to help you stay consistent and engaged with your routine. Additionally, we'd love to hear from you. Are there any strategies you want to explore? Do you want to know more about tips to reduce fatigue? Do you want to know about insurance reimbursement for these FDA cleared pulse oximeters? We are excited to share this future with you. Next slide, please. So I want to wrap up here with some actionable steps. Talk to your healthcare provider. Make sure, if you can, enroll in cardiopulmonary rehab, if possible. If cardiopulmonary rehab isn't an option, then you can use the checklist provided to have a discussion with your doctor and confirm the oxygen levels during activity and ensure any supplemental oxygen needs are addressed. Number 2, you need to gather up all of your equipment. If you have gained your medical clearance and you are ready to go, make sure you have that. If your doctor recommended a pulse oximeter, make sure that you've invested in a quality FDA cleared medical device and have it on hand. You're going to want to keep track of your stats in an app or a journal. Start tracking your heart rate, start tracking your oxygen, track your symptoms, track your activity levels, medications, and that'll give you a better understanding of your progress. Make sure you have your prescribed oxygen available and comfortable clothing and shoes. As I mentioned before, you're also going to need that sturdy chair with our armrests. When you set up your space, I want you to think about choosing a quiet, well-lit area where you can move your arms and legs freely. You're going to want a mirror, if possible, in front of you, because as people exercise, they tend to slouch, and that'll help you self-correct. And I think I already mentioned that you're definitely going to want some water nearby so you can stay hydrated. Lastly, I just want to invite you again, please reach out to FSR with your feedback. Stay connected with us. Hear updates about these pulse oximeters and clinical studies. All of these small steps are going to add up, and that is going to lead you to the right preparation. With the right preparation and guidance, you are setting yourself up for success. Next slide. So before I dive into these questions here, I want to thank everyone again for attending today's webinar. If you have submitted a question, we've taken the time to address these in the slides that follow. And if you're able to stick around, we'll be happy to answer those and continue to answer more. I just want to extend my deepest gratitude to the Foundation for Sarcoidosis Research for their amazing support. This webinar would not be possible at all without their work, so please keep supporting them. And thank you so much to Dr. Claire Child for her guidance and her encouragement throughout this entire process. Finally, I just want to dedicate this entire series to my dad and my grandmother because I admire their resilience and their courage so much, and it really inspires me every day. It drives my passion to make a difference in the lives of other families living with sarcoidosis. I hope you carry some of these practical tools with you and you have a little hope left from today's session. You can bring that into your daily life. Every small step we take together, whether it's learning, advocating, or caring for ourselves, that is making a meaningful impact in the sarcoidosis community. Thank you so much. All right, let's get into the questions. Okay, so the first question we had was I tried to order them here in the order of most frequently asked. What are the best exercises? What are the worst exercises? Best exercises are low impact cardio. So we're talking walking, that is the most scientifically supported. There is also cycling, yoga, any light resistance training, all very effective. The worst exercises, I'm going to say avoid any high impact, super intense, we're talking CrossFit. I guess ultra running, somebody did ask about, I would avoid that. High intensity or prolonged exercise stresses the body, especially if you're new to exercise. So for patients with pulmonary involvement, I also want to mention that swimming should be avoided because that added pressure from the water can put extra pressure on your ribcage, makes getting a deep breath even harder. So I would avoid swimming as well. And then, yeah, can you push it too hard, cause a flare-up? Yeah, you sure can. Overdoing exercise can exacerbate symptoms, and here is why. So while moderate exercise supports an anti-inflammatory state, extreme or prolonged physical activity, it disrupts that balance. The exercise-induced muscle damage, that starts to trigger the inflammation, and that is going to exacerbate your symptoms. So you really have to like hit the sweet spot of effort. You don't want to overdo it. It also causes reduced oxygen supply. So if you have impaired lung function, a big burst of intense activity might lead to low oxygen and ultimately make your symptoms worse. Next slide, please. Is massage therapy good for sarcoidosis? What great questions, everyone. Thank you so much. If so, which is the best type? So I looked this up, and yeah, massage therapy can create a lovely complement to improve your overall well-being. You should consult your provider because there are some people with pacemakers or other harder lung issues. Massage might not be the best option. The benefits, it might reduce pain, it might reduce stress, it might reduce inflammation, and that all can help manage your symptoms. The best types I found were Swedish massage to promote relaxation, and then like a vibration technique which can temporarily ease pain. I'm not currently having symptoms. Do I need to be concerned about what type of exercise I do? Yes, and I kind of touched on this before. Even if you don't have symptoms, you really want to avoid intense, super prolonged exercise. That is going to tip the balance from anti-inflammatory into raising inflammation, and we don't want that. What exercises can be done when you're having a flare-up? Ooh, I love this one. I would say gentle restorative movements. So I'm talking like wrist rolls, like easy breathing. And we'll start with warm-ups like this next time. And just some nice, easy trunk twists going side to side. It can be seated flexibility. We'll go over some of these next time, but very gentle. And these can help reduce stress. They can help improve fatigue. They can help maintain mobility. They can help support relaxation. Very gentle range of motion kind of exercise is what we would look for. Are there any curated exercise training programs? What a great question. I just want to give another plug to cardiopulmonary rehab. It's the gold standard, is what you want to get into if you are a sarcoidosis patient. Go ahead, next slide, please. What ways do you recommend increasing exercise when dealing with chronic muscle inflammation as a response? Okay, great question. I love this. And this is what we would do in cardiopulmonary rehab. Start slowly and methodically. You want to get on a treadmill, get a good baseline. What are you able to do? And then very gradually increase the incline. That is what I would do for just like maybe 2 minutes and then back off, and then 2 more minutes and back off. And that's how I would progress. Anyway, tracking your symptoms is also really important with sarcoidosis. You should use a journal or a record, record your fatigue and symptoms daily, and also record your oxygen and heart rate. And I would always recommend prioritizing recovery. Really pay attention to how your body responded to that. If you've progressed your exercise, make sure you don't have anything else going on so you can get good sleep. Make sure you've had a good meal after exercise, and you can balance it with rest. Sometimes I have respiratory issues when playing sports. Does this mean I should give up my sports? And I said, respiratory issues, that doesn't necessarily mean you have to quit, but safety is really key. So I want you to monitor your oxygen during your sports with a pulse oximeter, especially if you're experiencing more symptoms. If you can't maintain safe levels, even with extra breaks, it might be time to consider either training through a pulmonary program like we've been describing, or maybe lower intensity options like more relaxed league. I try to walk every day. How can I walk longer each day without overdoing it? So if you're trying to walk farther in the same amount of time, what you're going to have to do is increase your VO2 max. That we kind of touched on that earlier with, it's like the fuel mileage in your car. And the best way to do that is to gradually increase your intensity, like we talked about doing on a treadmill, just really slowly progressing and avoiding overexertion. If your goal is to just walk like, oh man, I've got one time I got to walk a really long distance. What am I going to do? For that, I would recommend pacing yourself. Walk a distance, take a break. Walk a distance, take a break, and monitor your heart rate and oxygen along the way. Adjust your intensity as you need. Next slide. All right, here we're at our last two. Is it okay to practice yoga if you have a lot of lung involvement? So I said, yeah. Yoga is a great low intensity option, generally safe. I would avoid, there are probably some positions where it's difficult for you to get a full breath. You might have to modify those. maybe adjust and do a different pose if that, you know, it's difficult for you to catch your breath in a particular position. I'd also monitor with a pulse oximeter and a heart rate throughout class, especially if you happen to notice an increase in symptoms. And then our last question, wow, does ultra running help cause more damage to lungs or the body with sarcoidosis? And I am saying, yeah, ultra running can pose some increased risks for people with sarcoidosis. There's, like we talked about, with moderate exercise, you know, those anti-inflammatory state is going, but with that extreme or prolonged activity, unfortunately, you're getting into that exercise-induced muscle damage. Those microtraumas to the muscles and connective tissue trigger acute inflammatory responses. So that is bad. I would avoid that. And then there's other considerations with medications like prednisone. You know, we kind of touched on bone health and things, and you know, that I've got some concerns with bone density as well with that. I'd be really cautious. And then oxygen and cardio stress, you know, big push, that's a huge demand for your cardio system. And I think it might be definitely put you at higher risk for low oxygen. If you really want to be a runner, that's awesome. But I would work really closely with your provider, and I'd always monitor your heart rate. I'd definitely monitor the intensity of your runs, and I'd prioritize recovery. I'd want to ensure you're taking rest days, and make sure you're getting plenty of quality sleep, make sure you're getting good nutrition. So I think that's all the questions I had ahead of time. Let's see. All right, submit questions here. We have, is weightlifting okay? And I think that's a great question. I mean, Claire, feel free to jump in anytime, but I would say I would avoid high intensity weightlifting with super high intense weights, you know, that over the top bodybuilder leg day might not be the best option right now. Claire, do you have any comments on that?
Yeah, I would say that typically the recommendation would be more low weights with high repetitions, not necessarily weightlifting for heavy amounts. And there's a couple of reasons why. We know that especially with some of the chronic prednisone or other corticosteroids, that there's a risk for bone loss. And so, you know, strengthening is helpful for and protective against that. But if you are doing really heavy weightlifting, you might be holding your breath. You might be doing what's called a Valsalva maneuver, and that can be dangerous for your heart, potentially making it so that your heart has difficulty beating against that additional pressure in your chest. So yeah, I would imagine, and typically the recommendations are strengthening at least 2 times a week.
Yeah, I just want to follow up with that and say, yeah, when we are going to work on strengthening in these sessions, yeah, we'll be doing more like functional moves. We'll be like bending over and rowing, you know, instead of like bench pressing and squats and deadlifts. I mean, I guess we'll do a variation of deadlift, but yeah, it'll be low intensity, you know, low weight, higher repetition, and we'll definitely be strengthening the muscles of your body. Your posture is going to improve. You're going to get the benefits. It's just a little different style of training. I see another question on acupuncture. And to be honest, I do not know about acupuncture for sarcoidosis, and I'll have to get back to you about that. Claire, do you have any?
I don't know of any studies. I would I would make sure to ask your provider about acupuncture. I know it can be helpful for chronic pain management. I can't think of any clear contraindications to it right now, other than maybe if you're experiencing some sort of a skin flare-up or infection, that would be more concerning. But I'm not aware of any studies specifically for acupuncture and sarcoidosis.
Somebody else mentioned here that they're pushing back on swimming, and that's been awesome for them. And I just want to say, yeah, definitely individual. So there's benefits and risks to every activity. Like maybe you're an awesome swimmer and like this feels really great for you, and you don't notice that you can't catch your breath at all, and it hasn't been, hey, great, enjoy your swimming. Everybody's going to be different. For other people, I just want to bring their attention to it. Yeah, it might be harder to catch your breath because of that extra pressure on the rib cage. But if you love swimming and you're already swimming and enjoying it and finding benefits from it, I think that's great. Claire, do you have any comment on that?
Yeah, I added in the chat a little explanation.
Okay.
Yeah, I mean, swimming can be actually a really great way to get that low to moderate intensity. Where we typically see it becomes uncomfortable is for people with more advanced heart and lung disease, where it may be difficult to breathe and you may feel claustrophobic in the water. It's also, if you are on supplemental oxygen, it's typically contraindicated just because it's difficult, of course, to take in oxygen while swimming.
Thanks, Marion and Dr. Childs, for being willing to stay on a little bit longer and answer some questions. Do we want to close out with one or two more questions, and then we can, since we'll be having future sessions, we'll fold in some of those answers to all of the wonderful questions we've been getting today, just to make sure that we're mindful of everyone's time.
Great. Yeah, I think there was just one more question in the chat. And it was really more of a suggestion. A session on challenges for those with CRT and or osteoporosis and limited mobility would be great as well. Well, thank you so much for that feedback. We really appreciate that. And I think that's all we have.
Great. Well, thank you so much. I learned so much from that presentation, and I'm sure I'm not the only one here who was inspired to really get serious about exercising. So we're so grateful to have both of you join us tonight, and for everyone in our audience who's joined us for this webinar, thank you to you all too. We're so excited to have more webinars in the future with Marion. So stay tuned and make sure you're signed up to get FSR emails because that will be your cue to know exactly when those will be happening. And we will be folding in answers to all of your wonderful questions in future sessions. So please keep them coming. And with that, we just want to wish you all a great evening. And thank you so much for joining us tonight.